And health officials in Kansas are trying to determine how a nursing home resident who died was exposed to the virus. Now, the man lived at the Life Care Center of Kansas City, Kansas. He was taken to Providence Hospital where he died. An autopsy determined he had the COVID-19. Health officials say it's clear this is a case where someone with the virus came in contact with the man.
We don't find the obvious, any particular obvious source of the infection for this person, but he was essentially bed-bound, so it's obvious that the infection came to him.
5 firefighters who transported the man from the nursing home are in self-isolation. Dr. Norman says the health department is doing everything it can to reach anyone who might have come in contact with the man. And today, the Life Care Center issued a statement that says, in part, as of today, we have no other patients or staff who are exhibiting symptoms of COVID-19. Prior to this incident and continuing now, we have been following all health department guidelines concerning COVID-19.
What if you have a loved one in a nursing home right now? Well, we wanted to know what steps local nursing homes are taking and what you need to know about going to them. Our Greg Payne is live from John Knox Village in Lee Summit. So, Greg, what's being done right now to protect the most vulnerable?
Ellen, we visited a number of nursing facilities, both on the Kansas side and the Missouri side, all of which are implementing a lot of changes. As for this group here in Lee Summit, their changes start right at the front door.
I've been doing this for 40 years, and during the 40 years, I've never seen anything like this.
Rodney McBride is the Vice President of Health and Community Services at John Knox Village.
And we're talking about an age group of 70 plus. That's the most vulnerable to the disease. These folks have been through a lot.
That's why they join a number of other nursing facilities in the area and enforcing stricter policies, including screenings for visitors.
And it's the questions that are recommended by the CDC to be sure that they haven't been in any high-risk areas.
They've also added an emergency response team to coordinate campus events, and they've implemented a voluntary ban on visitors that was recommended by the CDC.
And we've had a number of families that have said that they agree and they understand, but then continue to come and visit.
McBride says because of that, starting tomorrow at 3 p.m., that ban will go from voluntary to mandatory.
A mandatory restriction on visitation would mean that we would stop individuals from visiting regardless of the screen.
McBride says there would be few exceptions, but it's an option they feel would protect their residents. For the time being, they strongly encourage people to call or video chat residents instead of visiting.
It might be a little inconvenient for someone not to visit for a few days, but in the long run, it might be the best outcome.
Now, some of you guys might be asking, what about the employees? Now, we spoke with McBride, and he had mentioned that a lot of his employees have actually decided to self-isolate themselves so that they wouldn't go shopping or go to restaurants just because of the fact they don't want to bring something back to their place of work. Reporting live here in Lee Summit, I'm Greg Payne for KCTV 5 News.
Greg, thank you.